Good morning and welcome to Event Horizons. What a pleasure to be back with you bright and early. We're here Monday through Friday from 10 a.m. to noon Eastern Time. And I'm your anchor, Dr. Robin Falkov. And we've got an interesting show lined up for you, as we do every day. And sometimes it just amazes me how things unfold because we go with the breaking news, with these stories. And we've got some good ones. So for those of you who are tuning in for the first time, a big welcome to you. I'd like to tell you a little bit about myself. I'm an Oriental medical doctor, a homeopathic physician. I've got some Western medical training, and my website is healthfreedomrights.com, and that is my focus, protecting our health freedom rights, all of our rights, especially our right to have access to the necessary information so that we can make informed choices. And my friends, let me tell you, that is getting more and more difficult because those resources that we're so blessed with. I mean, what an amazing time we had in the beginning with the internet to just be able to find everything, read everything, dig up amazing information. Many of those sources have gone to pay for research data for physicians and others that need to go into more technical areas. And there are some groups that do make information available, and there are more popping up because of the disgust that so many have had with the National Institute of Health charging subscription fees of $2,000 a year and more for access to information that was freely given to them. And I'm talking about peer-reviewed studies, research trials, and research data from physicians, healthcare professionals, all given for free and all sold. Well, some of it, I guess, is made available, but there is a lot that is pay only. So we have the Public Library of Science, and then we have that beacon of light there, Green Med Info. And if you're just joining us, please know I always remind my audience to bookmark that site because it integrates pharmaceutical drugs, herbs, supplements, diet, exercise, lifestyle. It is the most comprehensive, or one of the most comprehensive, because it's one of the biggest in the world, so maybe it's number 2, if not number 1. But it is an amazing resource, and they do have different plans available for physicians that need access to more detailed research. But there is a wealth of information with the basic product that's offered, and you can sign up for their health alerts and get it delivered to your mailbox, which is really good. For those of you that don't have to have it all lined up across different browsers as I do, to be on top of what is breaking news each and every day. But I love it. I just really love doing this because it is very exciting to see how events are unfolding, where these trends are going, and are we getting some sanity, or is it the craziness as usual that we're facing? But you're here because somebody told you about Revolution Radio, and that is outstanding because this is one large family that you are now a part of. And we urge you to participate, to get involved, to know that your input is welcome. We can use your help for sure with research projects. You can volunteer your time for that. You can volunteer in chat rooms to be a moderator. You can have fun participating in roundtable discussions. And I'd like to remind you all that we have podcasts available if you want to be able to load and leave your smart devices when you're heading out and take the shows with you. And I ask you just, please follow what I've been saying. It's holiday time, so I know everybody's got their earbuds in and they're in their own little world. But perhaps you guys can not have your earbuds in, let the shows play and strike up some conversations when you're waiting in line, because that's pretty incredible when people will hear some of the information they've never had access to. So try it. You'll be surprised. I just had an experience. Oh, gosh. Producer Jerry, could you read that headline? Because I've got the sniffles right now for about 10 seconds.
Yeah, we would just like to let everybody know that we'd like you to go ahead to that site that Hawk just posted on the main chat there. It's Spreaker.com, user Revolution Radio. We'd like you to go there and join on, because we need to make contact with them in order for things to move forward here. It would be really nice if people could do that. Okay. That's about it.
Thank you. Thank you for that fill-in. I'm sure nobody wanted to hear me sniffling away. But yeah, I mean, we've got Spreaker.com. And that's for you to like Revolution Radio and join there. I mean, it's another way of listening. There are multiple ways for you to hear our shows when you're out on your smartphone, in your car. And I know I was filling out some of the information yesterday because I posted the Spreaker links on my Facebook page, and then I put it out on Twitter. And I think it went out on LinkedIn as well. I'm not sure. I'll check. But we have so many other shows. I mean, we have so many other FM networks. It is just amazing how far-reaching we are. And I thank you and Hawk for that pop-up, because the audience needs to know. They think, well, why do they need our donations? We are growing. We are growing. How do you think we manage with 71 hosts and everyone is volunteer only? It is a lot of equipment, a lot of technology. There was a very generous donor who wanted to remain anonymous that made available funds for a new 70-foot antenna and other equipment so that we can reach more and more people. And that is what is going on. So when you play those shows, when you're standing in line waiting to pay for Christmas purchases or food for the holidays or whatever it may be before you're sending packages in the post office, let us play without the earbuds, okay? Try it, and you'll be amazed at the conversations that you will have. And I'd like to tell you guys, I was in Costco last night doing some shopping, catching up on stuff, and I look around at a lot of things. I'm always curious to see products there. And it was kind of disappointing that they could have better choices, and they don't. And I'm a label reader. I hope all of you are label readers as well, because there's a lot to be learned with specifics. So here I see a package called Pure Via and Stevia underneath it, and I'm thinking, oh, isn't that great? Because I've used stevia for 20 years, 25 years, I don't know. I've used it for ages. I even have a plan. It's absolutely wonderful. It does not spike the glycemic index. It has other health benefits. There's a lot of spin about supposedly harmful effects that it has, which I've never verified or seen in any of my friends or patients that I got to actually be using this for years and years. So, okay, I've got some more details on that transformer for FM. That new transformer is a 50-watt transformer. 50,000 watt. Okay, see what happens when I read an order. That's a big deal, guys. That is a big deal. So, sorry to interrupt myself. I'm sure that sounds quite funny, but I didn't want to miss that, just so you get some perspective. So when you ask if you can help, you never know what you might be told. And you can always get back to the power of the dollar, which I ask you all to share with others, because that way we can all help. We can help here at Revolution Radio, and we can help other areas as well where it's not going to be a choice of, gosh, do I get those extra snacks for my kids, or can I help out and contribute money? No, the power of the dollar lets us all make a difference. But back to my trip to Costco. It was time to stock up on, a lot of things that they're great for, like the battery packs and some other, I guess, large boxes. I have to say, things that I don't use. My diet is raw, but for Richard, there's a lot that Richard likes. And then there are some other, basic household items, from tissue boxes, toilet paper, paper towels, that they do have good quality and they do have good value. But here I am going down the aisle, looking for my organic cold press olive oil, and they have good value on that as well. And I see Pure Via Stevia, and I pick up the box, and I look at the box, and I see the ingredients. Item number 1 is dextrose, okay? And when they are saying 1 packet is 1 gram, so when it is under 1 gram, they do not have to give the sugar content. So, 1 little packet is less than 1 gram, and they have stevia, cellulose powder, natural flavors. They have got fillers in it, and they claim that it's suitable for individuals with diabetes. Now, my friends, pay attention to language. Suitable does not mean safe, and that's a loophole, okay? The product I use is made by a company called Only Natural, and that is stevia extract powder, and it comes in a 1-ounce bottle, which probably lasts me for, 3 to 4 weeks, because you use a tiny, tiny amount. And what the ingredients are: 100% pure stevia leaf extract with a minimum of 91% steviosides. So you look at sugars, they are 0. And it's kind of a little flag once you start reading labels and understanding, to see that when it says sugars, less than 1 gram, that it's going to add up if you're going to have a few packets or more. This is different. Pure stevia is different. It's highly concentrated. The taste is strong if you overdo it. And they give you this little tiny spoon, or they used to. It's just almost the size of, I know my mother had saccharin that she used. They were these old little saccharin spoons to get out those little tablets or whatever they were. But the website is onlynaturalincorporated.com. They also have other products, and they have quality products. And I urge you to look for this one, and I will be following up, because the store manager and the customer service people were very interested in hearing the information, because they were using this pure stevia, and then they have a true stevia, and it claims that it's all natural, 0-calorie sweetener, and they thought that they were getting stevia. They did not read the label. And the store manager actually has stevia plants. His dad grows stevia plants, and he is going to recommend that they contact Only Natural to see if Costco can carry that. How about that, guys? That's a big deal. So you never know what happens when you speak up. And I also suggested, or I let them know, that I would be available, because what I see in their magazine, it's about food, it's about interesting items, and the health information is kind of generic, mainstream, nothing that's really solid, nothing that gives people more information about how to determine the proper food choices, how to read your labels, what the basics are in the world that's growing ever more. And they recognize that and understand that, and they said, wow, That's a great idea. So some interesting things in the works. I'm sure our own Melanie Vritschan is wondering, why is she talking so long? But as I told him last night in Costco, this is really important. I have to share it with my audience because I'm sure a lot of people are thinking, oh, this is great. And it's a bit of spin on something that is great, but not when it's combined with all of these other ingredients. So there's lots that we all can do. It's time for Melanie. I know she's got some great stories lined up. And Melanie is in Brussels, Belgium, and she reports on covert technologies, Morgellons, and lots of interesting developments where people can actually find out if they are invaded. I don't know if they have these strange chips or Morgellon type diseases, because there's technology that can measure the body's field. So we look forward to getting Melanie on with us and going over her information. And after Melanie, as you know, on Fridays we have WH, and he is always always interesting, always so much to learn. So it's an information-filled morning. So Producer Jerry, can we get Melanie on? I see she's there online.
Yes, I am.
She's there.
Hello. Good
and
afternoon,
she's there.
Robin.
Good afternoon. How are you?
I'm good. I'm pretty excited because, or let's say hopeful, because we, as I said last time, we, with two organizations, the European Coalition Against Covert Harassment and the International Center Against Abuse of Covert Technologies, are going to Geneva next week, actually next Friday. So I wanted to see if maybe after the meeting, we have the show with you, that we could maybe include a couple of colleagues and report on the results. We're going to the World Organization Against Torture, to discuss with them if they can give us some support in bringing this these issues of non-consensual implantation of unwitting citizens to the if they can help us to bring this to the attention of the European Parliament and the European institutions we're working with, because there are a big network. They have about 300 other NGOs in their network, and it's certainly very good for us that we can meet them. So, and discuss with them if they can get if we can get their support. So I'm very pleased this has been officially confirmed by the World Organization Against Torture yesterday. So the meeting is going ahead.
I am so excited to hear that, and we'll look forward to getting the update with your colleagues. That will be wonderful for people to get the first-hand information. So I thank you. So we have that to look forward to next Friday?
Yes.
Great.
Yes. That would be great if, like we did it last time before the scanning meeting, in fact, that I brought my two colleagues, Carmen Lupan and Diane O'Donnell, along. This time it would be Carmen, Diane, and also the director of the European Coalition Against Covert Harassment, Magnus Olsen. So it would be great if we could set that up for next week.
It's set.
Great.
It's set. So that's wonderful, and how impressive. You are a dynamo, Melanie. You really, really are. You make it happen. And I hope that those in our audience that wonder, gosh, what should I do, that they'll reach out and contact you for some guidelines and learn of your organizations. Could you give out the websites, please?
Yes, sure. So
Thank you.
There is the European Coalition Against Covert Harassment, and the website is EUCACH.org. So it's EUCACH.org. And then the other one is the International Center Against Abuse of Covert Technologies. It's ICAACT, so ICAACT.org, ICAACT.org. And both organizations raise awareness for the crime of non-consensual implantation of citizens with covered technologies, with remote influencing technologies. And in EUCACH, we focus a little bit more on the lobbying. We want to get appropriate EU legislation created to ban this kind of these crimes, because unfortunately these crimes that using modern cybernetic technologies are on the rise. It's not getting better; it's getting worse. So that's what we do with EUCACH, with ICAACT, as we already discussed. But also for our new listeners, maybe we provide victims or people that think that this could happen to them with evidence in form of a radio frequency scan. So this is what we do.
I thank you. And there's a way to write to you through those websites?
Indeed, yeah. So
perfect.
There is contact information, so there is a EUCACH email, and for ICAACT there is, depending on where you are in the world, we have primarily scanned people in the US and in Europe. So if you're in the US, you write to us@ICAACT.org. If you are in the European Union, you can write to EU@ICAACT.org. And if you are in the UK, especially, you can write to Diane O'Donnell at UK@ICAACT.org. So there are 3 contact emails depending where you are, and we provide these radio frequency scans for free of charge.
That is outstanding, and I know just how important it is. I just think of the people's lives that you've actually saved when they have been ridiculed or ignored or told they're crazy by families and physicians. So it's an amazing service. It truly is.
Yes, we also hope, we'll have to see, but that we are actually will be able, because there is also now a donate button on the ICAACT website, at least. So we hope that we will be able to actually open an office in the near future in the United States and in California, and so then we can even improve our services, and because the demand, Robin, is just it's overwhelming. Last time, as I said, when we had in October the Brussels scanning meeting, we just had to limit participant numbers because we were just overwhelmed. So that gives us an indication how many people actually are suffering from this and have been victimized with these covered technologies against their consent. In general, what they tell us is that the symptoms started after a surgery, so that they went for a surgery in the hospital, and then woke up with having symptoms like electrical shock sensations, heart palpitations, ringing tone in the ears, tinnitus, or even voices that they heard in the ears. It's possible via this technology to give the person audible commands, voices inciting them, putting them down, things like that, and many other symptoms that are generally associated with electronic terrorism. That either has a surgery, or some of them told us that they didn't have a surgery. They said that they had a vaccine.
Yes.
So typically a flu vaccine. Yeah.
And that is important because people don't realize how much can be introduced through a vaccine. And those reports have been out there for years, and people say, "Oh, you're crazy," and you're proving it.
Yeah, it's true. It is just so unbelievable that that people would do this to other people, but it is really true. And typically, when we scan these elderly ladies that told us they had never had a surgery, or they always came up positive in the upper arm. And when we asked them, well, ma'am, what did you have done there? Did you have a surgery? Did you have anything? And she said, no. The only thing is that what I have is my GP always gives me my flu vaccine there. And that's where the detector went off at this specifically anatomical point. So I think it's safe to say that they were implanted via a vaccine.
Yeah, it's very safe to say, and very ugly and very concerning. And you think of the people who tried to sound the alert that this was a problem waiting to happen. It was something that we would be seeing, and they were ridiculed and called crazy and conspiracy theorists, pardon me. And you're now proving that with the testing that you're doing. I hope to see a time where that diagnostic method is available around the world, because it's not a limited problem as you've just been describing. And there are too many people that need that verification so that they can have some vindication, because it's
True.
It's tragic. So
Yeah.
are there plans in the works?
Yes. This information, you can find it on the ICAACT website. We're actually going to construct portable Faraday cages that, so that we can do the testing more easily, with Faraday cages that you can, take with you. So that we can increase this verification, more, because the demand is certainly there and the need is certainly.
And we are back with more of Event Horizons with our team member, Melanie Vritschan. She's going to be able to give us a little bit more information about what's going on. So I know you've got a meeting coming up. So what would you like to share, Melanie?
Yes, actually the meeting's going to start in half an hour, so...
Okay, well, yeah. We'll just wind it up then real fast.
Absolutely, yeah. So, so at the last scanning in Brussels, we actually realized, because every time we do such an event, we meet new victims. And we realized how many actually were also in this region, like, Belgium, Holland, Luxembourg, and the north of France. Who were the countries that were most represented at the scanning. So I suggested that if they were interested, I'm actually doing this in collaboration with another Belgian American lady. We had the idea that it would be nice if we would meet the victims in our region, maybe once a month, to get to know each other, to discuss our issues, and if we could regroup to do something about this horrendous violation of our rights, of our basic human rights and our health that has been destroyed. So and much more than that. So yes, so we have today our first meeting. I don't know yet how many people will show up, but certainly I have there have been about 15 people that have expressed interest and said that they would try to come, which is not bad. So that live here in this region around Belgium. So yes, we will see. This is the first meeting to get to know each other, and we can see what we can create, out of this, and how we can defend our rights together.
Well, that is very exciting. I know when we were going to break, you were talking about, or a little bit before that, having portable Faraday cages so that you would be able to reach more people. What kind of expense are you looking at with that?
Well, it's not going to be cheap, does I know. I don't know exactly, because it's mainly Jesse Beltran from the United States and Lars Stuttgart who are involved in this, because they're our technicians, so technology specialists. So it is Jesse who has made the contacts, and we have, what I know is that we have found capable people, scientists that can help us with the construction. So it will happen. Soon on the website there will be more information about what is actually the amount we're looking at, and how this construction will go about. What are the next steps, so that people that are donating to ICAACT, that they know what their money is for, and how much it will cost, and all this. So the information is pretty new, so I don't know yet. But there will soon be new information, clear information and details on the ICAACT website regarding the construction of the Faraday cages.
Well, that's wonderful. At the speed that you move, Melanie, if it's new, they'll be seeing it really soon. So I'm impressed, and I'm just so pleased to have an opportunity to give hope to so many more people that are suffering from these problems which make them doubt their own sanity, and that is a crime.
True. Yeah, it's true. It's very sad that most of these people, when they come to their physician, they complain about these symptoms, that they're sent to a psychiatrist. They're just not believed or not listened to. And so we have had people that have been committed to mental hospitals. And when they finally came out, I must say they were even worse off, certainly than when they were often against their will actually committed to these institutions. So it is very bad. So that's very, very, very important that we provide this evidence to people. So we hope that in future that will not happen anymore, or happen much less at least.
Well, you're doing an outstanding service, and I'm very excited to hear more details next week with your team members about what the presentation will entail and what you will have in store, because I mean, with your organizations being set up, and I know there are international conferences, and now going to Geneva, very impressive.
Thank you. Yes, from what I understand, is there at the location where we will be staying, there will be a Wi-Fi connection, so I have internet there, so I should be able to set it up, and I will send you the details of the people that I would like to include in our next discussion.
Oh, perfect.
So it should work.
Okay, you'll be live on the scene then. That's wonderful.
Yes, we will be from Geneva, speaking from Geneva.
Okay, well, my thanks to you for staying over. I know you're excited to get to your meeting, and I don't want to hold you up, but we so appreciate your work.
Okay, thank you.
Yeah, thank you, Melanie. We'll look forward to next week, and good luck. Good luck with it all. Very exciting.
Thank you very much.
Okay.
See you next time.
Bye-bye. Yes. Bye-bye. Oh, gosh. Isn't it nice to have good news? And isn't it nice for you, the audience, to be inspired by Melanie's efforts, because you can reproduce those in your community or with your friends that are concerned, to form groups. I mean, there are online organizations. I think there are even Google chats that you can get together and share time with each other, Skype programs. There are many, many different ways that you can organize, because that's what it comes down to, my friends, the ability to organize and share that necessary information so that we can make informed choices. And when you have someone like Melanie, whose own life has been affected by this technology, well, it's time for you guys to pay attention and just look at what she's achieved in this very short period of time, because that's the idea of getting this information out. So others know, wait a second, I can make a difference. It really is possible. This isn't hopeless. This isn't something that will never get better. You follow through, you persevere, you talk to other people, which is the first step, and then the miracles take place. So keep that in mind, because it's all up to you. It's up to you, it's up to me, and together we become a force that can be reckoned with. And I'd like to remind you of the wonderful resource that is provided by CELDF.org. And okay, that's one of my papers that got spared. Let's see. And for those of you that have not heard about it, it is the Community Environmental Legal Defense Fund, CELDF.org. The executive director is Thomas Lindsay, who's an attorney. They're a nonprofit law firm which has assisted over 300 community groups and municipal governments across the country. And this movement consists of local communities which are beginning to use municipal lawmaking power to transition towards economic and environmental stability, which is a big deal, my friends. Lindsay talks about, they have communities in 8 states across the country that are using the law to move towards sustainability and elevate the rights of people, communities, and nature above powers claimed by corporations and other governments.